Hello, my name is Ethan Taylor, and welcome to Pediatric Migraines. Before we hop in, what are migraines? They're a type of headache. That's not terribly descriptive, so let's go into a little more detail. The pain, compared to other headaches, is unilateral, throbbing, and made worse by movement. Migraines are neurological. They appear as waves of odd neuron activity in brain imaging. In EEG, both resting state and stimuli response is distinct from control. Symptoms of migraine commonly include nausea and vomiting, and in many people, these lovely things known as auras. Auras look a little like this: gaps, blurs, and colors in vision. Now that that's covered, this presentation is about pediatric migraine. So what about the kids? In children, the incidence and likelihood of migraine, like all experiences, increases with age. 1 in 50 children by age 7 will have experienced a debilitating migraine. Then 1 in 20 by age 10, and 1 in 10 by age 15. Symptoms don't change all that much for children, except the pain in children is often bilateral instead of unilateral, of a shorter duration, and auras, which are more common in adults, are less common in children. So how are they diagnosed in children? There's no single test for migraines. Typically, it's a combination of family history and ruling out alternatives by assessing general physique and rarely, through the use of CT scan or MRI, ruling out things like brain tumors or brain malformity. So what can we do about migraines in children? Commonly, the answer for something that can only be found by ruling out everything else is medication. Drugs used for children are prescribed based on studies in adult cohorts. The common choices are amitriptyline and topiramate. But the odd thing is, one study revealed that while they are effective in adults, they aren't in children. Note the blue bar on the left. This is the percent of the experimental group that was statistically identical to control in terms of migraine frequency and reported debilitated days. Note the difference between drug and placebo. These drugs are effective on adults. So, where does that leave us? Prevention. But how do we prevent it if we don't know what causes it? We do have some idea. Migraines are grounded in blood flow. To where? The meninges. In people with migraines, there is an implicated sensitivity to cytokines in the meninges. And so anything that can cause an upsurge in inflammation can cause migraines. So back to prevention then. What causes inflammation? Stress, hunger, thirst, lack of sleep. All of these things cause inflammation. So the answer to treating migraines in children is in basic health. Children should be taken care of and be taught to take care of themselves to reduce the frequency of migraines, especially because they're largely temporary. The prognosis? Migraines are not typically lifelong. One study found that in a cohort of 122 children, 60% had no symptoms after a year. 75% had no symptoms after 2 years. And after 8 years, only 12% of children still experienced symptoms of chronic migraine. But for those few that still had symptoms, they're adults now and can use the adult treatment. Thank you for watching.